I'm Dr. Emma Hint-Nichols, and this is this week's latest US FDA approvals for the week of August 14th through the 19th of 2023. And as always, you can see the full write-up of today's episode at nascentmc.com/podcast. So we have a couple of approvals this week, especially in the rare disease space. So the first up is Elrexfio for relapsed refractory multiple myeloma. The FDA has granted accelerated approval to Elrexfio, and that's a generic name, elranatamab-bcmm, for the treatment of adult patients with relapsed refractory multiple myeloma who have received at least 4 prior lines of therapy, including a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 monoclonal antibody. Approval was based on the results of the single-arm phase 2 MagnetisMM3 trial, and continued approval of Elrexfio for this indication is contingent upon verification of clinical benefit in confirmatory trials. Elrexfio is a subcutaneously delivered bispecific antibody immunotherapy that binds to BcMA on myeloma cells and CD3 on T cells, activating T cells to kill myeloma cells. This accelerated approval was granted last week to Pfizer. Elrexfio joins Talvey and Tecvayli, 2 bispecific antibody immunotherapies from Janssen, that are also indicated for relapsed or refractory multiple myeloma. Also last week, the FDA has approved Hepzato Kit, a system that delivers melphalan to the liver as a treatment for adults with metastatic uveal melanoma with unresectable hepatic metastases. The approval was granted to Delcath Systems. Hepzato Kit is currently the only liver-directed therapy approved by the FDA for the treatment of metastatic uveal melanoma. The approval was based on results from the phase 3 FOCUS study. The manufacturer stated that Hepzato Kit may have broad applicability in other tumor types, and to quote, "We intend to expand our development efforts beyond uveal melanoma, given the high incidence of unresectable hepatic dominant tumors." Also last week, the FDA has approved a higher dose version of Eylea, a aflibercept injection, for the treatment of patients with wet age-related macular degeneration, diabetic macular edema, and diabetic retinopathy. The FDA approval is based on the 48-week results of Pulsar and Photon pivotal trials, comparing Eylea HD high dose 8 milligrams at intervals of every 12 or 16 weeks to the standard Eylea injection of 2 milligrams every 8 weeks. Both trials met the primary endpoint, with Eylea HD demonstrating non-inferior and clinically equivalent vision gains at 48 weeks at longer dosing intervals without additional safety issues compared to lower dose Eylea. Eylea is a VEGF inhibitor and was first approved in November 2011 for wet age-related macular degeneration. The approval was granted to Regeneron Pharmaceuticals, Inc. Is your company in need of medical writing assistance? Visit our website at nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, AdWord summaries, and much, much more. And we can also do it with a quick turnaround and also on any therapeutic area. We're like your favorite freelancer who's always available. Do check us out at nascentmc.com. The FDA has also approved Ingrezza, and that's also called valbenazine, capsules for the treatment of chorea associated with Huntington's disease. The term chorea refers to the involuntary, irregular jerking movements commonly present in individuals with HD. The approval is supported by data from 2 clinical studies, Connect HD Phase 3 and the ongoing Connect HD2 open-label extension trials. In the United States, the estimated prevalence of Huntington's disease is around 5 to 10 cases per 100,000 individuals. Ingressa is a vesicular monoamine transporter 2 VMAT2 inhibitor and was approved for the treatment of adults with tardive dyskinesia in 2017. The latest approval was granted to Neurocrine Biosciences. Other agents used for Huntington's chorea include xenazine, which is also called tetrabenazine, and Austedo, which is also called deutetrabenazine. Also last week, the FDA approved Sohonos, which is also called palovarotene, and that's an oral medication to treat the rare bone disease Fibrodysplasia Ossificans progressive, FOP, in females ages 8 and older and males ages 10 and older. FOP results from activating mutations in ACVR1 and ALK2, which is a bone morphogenetic protein, BMP type 1 receptor, and affects an estimated 400 people in the US. As the disease progresses with flare-up episodes causing rapid bone growth, heterotopic ossification severely restricts mobility and function, leading to premature death. The FDA approval is based on pivotal efficacy and safety data from the phase 3 MOVE trial, which shows that Sohonos effectively reduced the annualized heterotopic ossification volume compared with no treatment beyond standard of care. Adverse events were consistent with the systemic retinoid class to which Sohonos belongs. Sohonos is selective for the gamma subtype of retinoic acid receptors, which is an important regulator of skeletal development and ectopic bone in the retinoid signaling pathway. Sohonos, which is manufactured by Ipsen, received orphan drug and breakthrough therapy designations. And another treatment for a rare disease, the FDA has approved the first treatment for CD55 deficient protein-losing enteropathy, also called CHAPLE, C-H-A-P-L-E disease. The treatment, Viopos, also called pozelimab-bcmm, is a complement inhibitor and is indicated for patients 1 year of age and older. CHAPLE, which stands for complement hyperactivation, angiopathic thrombosis, and protein-losing enteropathy, is caused by mutations of the complement regulator CD55 gene and triggers an autoimmune attack of the complement system. Fewer than 100 patients worldwide are thought to have CHAPLE disease, which is associated with several symptoms, including life-threatening thrombotic vascular occlusions. Viopos received Fast Track, Orphan Drug, and Rare Pediatric Disease designations. The approval was granted to Regeneron Pharmaceuticals. And we have upcoming PDUFA date this week of Lion Bio in partnership with Tarsus, which has announced the submission of TP-03 for the treatment of Demodex blepharitis, and the target action dates listed as August 25th next week. There are no other events scheduled in the calendar, but there will be, I'm sure, lots of news to report next Monday, so please do check back for that episode next week.